We're joined by Dr. Ashish Jha, Dean of the Brown University School of Public Health. Dr. Jha, thank you for joining us this morning. And let's start with the basic question. This variant is said to be more contagious. Does that mean we need to change the precautions we've been taking as far as wearing masks and socially distancing?
Yeah, good morning, Michael. Thanks for having me on. It does not mean that. In fact, all of those precautions are going to work just as well for the variant. The key issue is to really have those precautions in place all the time. In the past, and with the other strain, if you were exposed, you didn't always get infected. The chances you're going to get infected if you're not doing those things gets much, much higher with this variant. Of course, we also means that we're going to see a lot more community spread of this virus, of this variant. So it's a concerning situation.
Well, do you think this variant being more contagious could actually be worse than if it were more severe?
I do, because the bottom line here is that if it's more contagious, it's going to spread much more widely. A lot more people are going to get infected. A lot more people are going to get hospitalized, and a lot more people are going to end up dying. So obviously, we don't want either contagious or deadlier, but more contagious will probably end up meaning more people end up dying from this virus.
And the British Prime Minister announced another lockdown for all of England on Monday, citing the need to get this variant under control. It's been detected in several U.S. states. So could we be headed towards a lockdown?
Well, I think the variant is probably pretty widespread across the United States. If it's in 4 states, in people who haven't traveled, it stands to reason that there is community spread of this virus happening. Whether we're headed towards a lockdown depends a lot on how much we can do right now to avoid that kind of exponential growth that the UK is having. It's really up to us.
And the vaccine is out, but the rollout is way behind. There are just 4.5 million doses administered. So what is the biggest problem with that, and how do we fix it?
Yeah, I think we need a lot more federal leadership here. States are struggling to get these vaccines out. I think we need to get resources to states. We need the federal government to partner with states to set up vaccine sites. There's a lot of work that needs to be done. Most of the vaccines we have produced are sitting on freezer shelves. They need to be in people's arms.
Dr. Jha, thank you so much. We always appreciate your input.
Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.